Go. Perfect. Okay, sorry. So Erin is a psychotherapist and educator who works with adults and adolescents. She began her career many years ago working in community mental health with children, and over the years worked in a variety of treatment facilities with adolescents and adults. In 2000, Erin transitions to private practice. She also works as a per diem therapist for Seven Arrows Recovery, where she provides brain spotting for addictive behaviors. Erin has also been a professor for 14 years and is currently an adjunct professor at Grand Canyon University. Erin is trained in brain spotting and accelerated resolution therapy. She's a lifelong learner who continues to explore and diversify her abilities to help others, and she is passionate about guiding and supporting individuals in their journey to become the best version of themselves. That is amazing. I'm going to stop sharing my screen so you can share yours now.
Great.
I know technology is always the fun.
Always fun. Uh-oh. Okay. Well, thank you so much, everyone, for taking time out of your day to be here. I really appreciate this opportunity to talk about brain spotting. It is something that I am very passionate about. So brain spotting is a new therapy modality that actually allows the clients to process through past experiences and also train themselves to process through new experiences as they come up in a healthy manner. So that's kind of the nutshell. But brain spotting actually gives the therapist access to both the brain and the body processes. So the goal is to bypass the conscious neocortical thinking brain to access the deeper subcortical emotional and body-based parts of the brain. So basically what it does is it allows us to focus on the sensations and emotions, right, while providing a safe environment for the client. So we basically bypass the talking piece and we focus on the feeling piece.
Erin, really quick, I'm sorry. Were you sharing a PowerPoint?
I did. Did you not get it?
No, we don't see it. Sorry.
Oh, huh.
And I'm happy to run it from my end if you want to email it to me if it's not working. Let's see
See.
here. Okay, making sure it looks like I have it set, or you should be able
Let's
to.
try one. Let me try one more thing.
Okay, sure.
I don't know. No, it's not coming up for some reason.
If you want to email it to me, and just keep talking, and then I will start sharing it as soon as I get it.
Okay.
No worries. I know technology sometimes can just be
Love it. Okay.
great, or it can be, oh my goodness.
Right.
Julie said, don't worry, it's happened to all of us. More times than I can count for sure.
It's always when it works just fine, right? When you're practicing before.
Of course. It's never, yeah.
Nope.
Okay.
It is on its way to you. It's slowly uploading.
No, of course. Yeah, it's always, that's why we have the time built in for the just in cases, right?
I apologize. I guess it was a little bit long.
Oh, no worries.
Okay, so let's see. Okay, I just sent it to you.
Okay. And it may be taking a minute on my end.
Maybe. Okay, well, I'll go ahead. I can see it on my end.
Yeah, go ahead. And then
Hopefully that's
I
okay.
will, as soon as it comes through, I will start sharing.
Okay, great. Okay. So again, brain spotting therapy integrates everything that we know today about the brain and the body to help individuals deal with trauma and addictions. Okay, so brain spotting is a client-led therapy, which I love. The clients are 100% control with what is going on. And when they start to notice healthy changes, it's very empowering and motivating. Brain spotting utilizes eye position to locate, down regulate, and process traumatic emotions while creating safety in a highly attuned relationship with the therapist.
I apologize for interrupting, Erin. Your camera's off if you want to turn that back on.
Okay. So brain spotting was discovered in 2003 by Dr. David Grand. So at the time, he was a psychotherapist who lived in New York, and he was trained in EMDR. And within weeks of 9/11, he started working with a pretty steady flow of survivors after the attack. And he discovered about a year after working with the survivors, both consciously and unconsciously, he learned to observe the physical cues so acutely that at times it almost seemed like he knew what was coming before it even happened. So it was in that heightened state of tuned in preparedness that he discovered brain spotting. Okay, so the idea behind brain spotting is where we look tells us how we feel.
And you can just tell me what page to go to, and then I'll.
Okay, I think it's on the fourth side.
Okay.
The next one. Yep, perfect. Thank you. Okay, so where we look tells us how we feel. Okay, so if you guys take a second to think about a time maybe you were talking about something that felt uncomfortable. So maybe you felt like you may cry or you were going to get angry. What we'll do is we will actually look in the opposite direction or somewhere different so that we don't feel activated, so that we don't cry, right? Or we get angry. And during brain spotting, what we do is we have that individual go back to looking to the area where they felt uncomfortable. And what that does, is it allows us to access the area of the brain that stores all of our emotions and experiences that we've had since we've been in our mom's womb. So I'll get into that a little bit more later, but that's why we use sight. So what is a brain spot? A brain spot is actually the activity in the subcortical brain in response to focused activation and eye position. Okay, so the eye reflexes indicate the presence of a brain spot. So what I'm doing is when I'm talking with a patient, right, or a client, I am watching different involuntary responses. I'm noticing where they're looking, right? And then once we find that spot, I have them hold that position. Okay, so when a brain spot is activated, the deep brain appears to reflexively signal the therapist, okay, beyond the awareness of the client's neocortex, that an area of relevance is located. So what I will notice is some sort of involuntary response. Most of the time, the client is not aware that they are responding. So I'm looking for, rapid eye blinking, any possible twitches. So they may have twitches in their face, in their legs, right? If their stomach growls, if they're yawning. So any kind of involuntary response like that is a signal to me that we are in the right area. Okay, so the neocortex, also just to circle back around, right, is part of the cerebral cortex. So the the neocortex is responsible for attention, thought, perception, and episodic memory. So again, what we're doing is we're taking the talking, thinking piece out of it, and we're having the client focus on the sensations in their body. Okay, we ask the client to guide us. This is a client-led therapy. So I want to know, right, what's going on with the client. So I will ask them, okay, what's going on right now? What do you notice in your body? Scan your body from head to toe. Okay, where do you feel the sensations the most? And that's the point where we want to focus. Okay, our body remembers everything. So one really cool thing about brain spotting is that if somebody has a traumatic brain injury or if there's something else going on where they don't remember a particular event, I have a lot of clients that don't remember their childhood. They don't need to remember it. They don't need to verbalize it to me because their body remembers. So they can still utilize brain spotting and it will be highly effective. Okay, so next slide, please. So we have two models of brain spotting. Okay, we have the activation model and the resource model. So with the activation model, the therapist matches the spot to where the client feels it the most. Okay, so, and there are different tools that we can utilize to find that spot. Sometimes we'll just use a pointer. Sometimes if I'm having a conversation with the client, right, and I'm watching where they're looking while they're talking about different things, I can just utilize that, what we call a gaze spot. If I'm using a pointer, right, the pointer is not the key. The key is the area. Okay, so just the area that they're looking in. So you don't necessarily need that. When I'm working with someone who's younger, a lot of times if I'm watching, them get activated when they're talking about a particular situation or event, and I notice where they're looking, I might throw a coaster down. I might put a sticker somewhere. So you can be as creative as you want. But the important piece is obviously being highly attuned to what's going on with your client. The resource model is extremely important. So this is the area of calm or groundedness that's located in the body while the client is activated. Okay, this helps provide containment for clients who feel overwhelmed. So there are a lot of different techniques that we learn that we can utilize to help ground the client. If you have a client that is highly reactive, right, this may be a conversation that you would want to have before starting brain spotting. Again, you want to be as creative as possible, right? So you can have a client kind of scan their body, notice where in their body they feel calm. And if they get too activated during brain spotting, you can have them go to that particular area in the body. You can have them create a safe place through guided visualization before starting to brain spot and utilize that as a safety mechanism to help ground them. You can have them pick out a picture if they're not able to kind of come up with something in their head. You can just have them look at pictures, right? If someone dreams of going to the beach, or they've had an amazing vacation, or whatever it is, a place where they feel safe, walking them through their senses, kind of developing that, you can bring up that picture during brain spotting. So brain spotting is very flexible. I know with some of the other techniques, right, they're very structured. Brain spotting, you can lay down on the couch. I have some younger clients that will, lay on the couch. Some of the kids will walk, smaller children will walk around, different things like that. They can move around, they can itch their nose, they can sneeze. It does not throw anything off. So that's one of the other things that's kind of cool about it too. Okay, so the next slide, please. So just throwing up a picture of the brain, right? Obviously, we have the limbic system, the brainstem, and the spinal cord. Okay, so brain spotting accesses the limbic system and the brainstem, right? So we do that through sight. All of our emotions, again, and experiences that we've had since we've been in our mom's womb are stored in the subcortical area of the brain, at the base of the brain. The subcortical structures include the corpus callosum, the thalamus, putamen, amygdala, and hippocampus. And each one of those structures undergoes significant changes in childhood. Okay, so that obviously becomes very important when we're looking at that particular area. So one of the things also that's very important to do is to have a conversation with the client about how their brain works and how sensations and symptoms are stored and held in the brain and the body. Okay. So unprocessed traumas are really stored in the brain like computer files, we can say. Next slide, please. So just provided an outline of our nervous system. Okay, and this is important because then our central nervous system plays a significant role in the healing process, and brain spotting focuses on the central nervous system and the brain. So obviously with the central nervous system, right, we have the brain and the spinal cord. That is the part that makes up complex decisions, it coordinates bodily functions, and initiates most of our behaviors. Okay, moving down, we have our peripheral nervous system. Okay, those are the nerves that connect all parts of the body to the brain. So that includes the autonomic and somatic nervous systems. The peripheral nervous system connects the central nervous system with the rest of the body. So it's sort of like a pickup and delivery service. Okay, so moving down. And I'm not going to focus on all of these. I'm just going to focus on a few of them, the ones that are really key in brain spotting. But we have the somatic division, right? That carries information to the central nervous system. It sends voluntary messages to the body's skeletal muscles. So for example, if you see a slice of pizza, right, the visual image is carried to the brain by the somatic division sensory system. If all goes well, the motor system sends instructions to the muscles that propel the pizza on just the right trajectory into your open mouth, okay? So the autonomic system, which is self-regulating, right? That division sends communications between the central nervous system and internal organs and glands. So this happens unconsciously, okay? So as we see, the autonomic nervous system is divided into sympathetic and parasympathetic divisions. Okay, so the sympathetic nervous system sends messages to internal organs and glands that help us respond to stressful and emergency situations. This is our fight or flight, freeze or fawn system. Okay, and the parasympathetic division monitors the routine operations of the internal organs and returns the body to calmer functioning after arousal by the sympathetic nervous system. Okay, so the parasympathetic applies neural brakes, returning the body to calm and collected state. Ideally, the sympathetic and the parasympathetic work together like a teeter-totter. Okay, so with brain spotting, we can actually reset the central nervous system to process through situations as they arise in a healthy manner. Okay, and that is ideal. So while we are processing through old situations, right, and basically deleting any negative emotion that's attached to those situations. So we cannot get rid of memories, but we can actually get rid of the negative emotion that's attached to the memory. We can also reset the central nervous system to process through new situations in a healthy way. That is ideal. While we're brain spotting, once we start brain spotting, a neural pathway remains open. So each time we do it, it gets easier and easier to get into that different level of consciousness. And all that means, and sometimes that's kind of scary for clients to hear, but all that means is instead of talking, they're feeling. Okay. So as time goes by, you get stronger and stronger. And again, as situations come up, we are able to handle them in a healthy way. And it's something that is occurring internally. So while we're making these changes internally, right, we're still going to utilize all of the other skills that we're learning, whatever that is, right? But there's nothing better than having that come from the inside out. It almost feels more proactive, right, instead of reactive. So the day that somebody comes in to do brain spotting, there is kind of like a muscle memory to it. So their body and their brain will continue to process once they leave the session. And it's always something that's working in the background. So with my clients, not everybody wants to brain spot, right? Every time they come to a session, which is fine. So if somebody came in and did one brain spotting session, they never lose what they've gained. So even if they didn't do brain spotting for another, 5 years, they could go back and do it. And there still would be that neural pathway open, and they start, from the foundation that they've already laid. So they don't ever lose anything. Next slide, please. Okay. So as I mentioned, right, brain spotting promotes coherence between the sympathetic and the parasympathetic activation, which ultimately allows us to manage stress better. Okay, and again, unprocessed traumas are held like computer files in the brain. So a brain spot correlates with one of these files, and it starts to delete the negative emotion that's attached to that file. So we're slowly filling up our trash can. Okay. So if you think about, if we have our basic emotions, so let's say we have anger, right? And then we'll have secondary and tertiary emotions. If we have frustration, irritability, right? All of those emotions will fall under that umbrella. So if an individual decides to focus on a particular event that elicits some sort of angry sensations for them, we would ask them to scan their body and notice where that comes up for them in their body and have them focus on that particular area. And once they start to do that, all of those computer files that are connected to any kind of emotion that's related to anger will start to delete. So there's a bulldozing effect with brain spotting as well. So a lot of times if somebody starts in a particular place, other things may fall into place on their own because of that scooping effect. So that can be really empowering as well. So when an individual comes in, I don't necessarily need to know the details of any past trauma or even what they want to process. I obviously am going to do, right, an intake session. I'm going to make sure that they are stable enough. And by that, I mean they're not suicidal, right? They're not in crisis. That they have a support system in place, whatever that looks like, right? All of those things that we do before doing brain spotting. And they don't have to relive a traumatic experience by sharing that with me. And so that's one of the great things about brain spotting also. It's also really cool for us, right, as clinicians or whatever your role is, to not necessarily have to hear all of those traumatic experiences, like we normally do. And so that creates a nice boundary for us as well. Typically with brain spotting also, if somebody's coming in just to do brain spotting, and it is for something specific. So maybe an individual has a huge presentation coming up at work, and they have a very difficult time speaking in front of people. Usually 1 to 5 sessions is recommended. Obviously, it depends on the age of the person, right? Their history, things like that. Brain spotting is so unique that it's really individualized. So even when I'm kind of giving my clients the overview, less is more in that regard, because literally you don't have any idea how somebody's brain and body is going to process. So it's really just being, present for them and being curious about what comes up and having them be curious and really trust that process. So next slide, please. So I mentioned it a little bit before about being highly attuned with your client. So that is the key for brain spotting, is the dual attunement. So when the therapist is simultaneously attuned to the client and the client's brain processes, right? So creating that safe space, holding space for your client, really being present in the moment. It's like if the client is the comet, we are the tail. So we are literally going wherever the client is going. We are not talking. We are just holding space and being present with them. When those two are interwoven, the healing process is powerful and lasting. So with brain spotting, I saw a little pop-up, but in order to get trained, the first one is just phase 1. It's a 3-day training. So once you go through phase 1, you are able to work with your clients and do brain spotting. There are additional trainings. So there is a phase 2, which just goes a little bit deeper. There are additional techniques that are taught in order to find the brain spot, and also to help clients, I guess, decrease activation if they feel, if things are too intense. The other thing is, the client, they can stop if they want to stop too. Anything that they do, any time that they do is valuable. So, I have a couple of younger clients that have complex trauma. One client, she does 8 minutes. 8 minutes is huge for her. She's probably done 3 sessions of 8 minutes in the last 6 months, and she's a completely different person than she was when she started. So any time is valuable. And like I said, each client is unique and it's their process. Our brains have a safety mechanism. So if somebody is not ready, their brain may shut it down, and that may look like dissociation. That's okay too. So they will do it when it's ready. And even just those little moments that they were open to brain spotting, they have that, and that will stay with them. So the next time they do it, maybe a little bit more. The only criteria, honestly, for someone to be able to participate in brain spotting is that they're open to it. That's really the key. So, kind of going back, so we had phase 2. There's also a phase 3, which is a deep dive, and that is just for clinicians, which is phenomenal. There's also a brain spotting for parts work. There's a brain spotting for dissociation. And then there's also brain spotting for addictive behaviors. So next slide, please. Okay, so brain spotting, believe it or not, we can actually do brain spotting with infants all the way up to adults. So again, the younger somebody is, right, the easier it is, the less number of sessions they need to do because the less they have been exposed to. It works phenomenal for clients who need to remain grounded during the treatment process. They dissociated, and obviously with psychological trauma, PTSD, addictive behaviors, grief, physiological and physical pain. I do work with a lot of clients that have chronic pain. While obviously this does not fix, quote unquote, any medical diagnoses or issues, that has a huge impact on mental health. So I've seen amazing things happen. Okay, next slide, please. Okay. So one of the brain spotting techniques that I am trained in is a particular technique called the Crocodile Technique, and that is for addictive behaviors. So my background is in addiction, so that is one of the reasons why I chose to go through that training. It's absolutely amazing. So it's developed by Dr. Roby Abels. She has been in recovery for 30 plus years, and she developed it. So she actually is from Australia, and she likens addiction to a crocodile. So while a crocodile will sit and wait and wait and wait and follow patterns, right? At someone's most vulnerable time, when they possibly may be complacent, is when the crocodile strikes. And so that's why she calls it the crocodile technique. Next slide, please. Okay. So addictive behaviors. So obviously this is not all inclusive, but some of the things that we can utilize this particular technique for are substances, disordered eating, the process addictions, self-harm, OCD. I have utilized this particular technique in addition to just regular brain spotting with OCD, and it is amazing. Next slide. So brain spotting therapy for addiction is a multi-stage treatment model that acknowledges traumatic and dissociative experiences as important components. So next slide. And this piece is important because we're looking at while it is a brain spotting technique, it is a very different technique. So when we're looking at the addictive behavior, we want to make sure, obviously, again, that the client is stable, right? We're looking at skills development. Definitely if they have coping skills, what coping skills they have in place, if they have a support system in place. There's emotional self-regulation, right? That they are either pursuing some sort of addiction or recovery treatment, they have been there, that they're working on that with you as a clinician in their sessions. That piece is very important as well. We are also looking at any unresolved pain and trauma. And then again, post-traumatic growth, right? Because we don't just want to focus on the addictive piece and send them on their way, right? There's usually multiple routes, and we want to make sure that we cover all of their bases so that we can set them up for success. So next slide. Okay, so with the crocodile technique, part of the treatment involves connecting the sensations in our bodies linked to cravings with feelings of negative consequences. So with regular brain spotting, right? We're just focused on the overall sensations in our body connected to a particular event. A lot of times I'll have clients, maybe they're not sure where to start or they can't think of something, and they're telling me they have a really bad headache. I'll have them focus on the sensations, right? That's creating the headache, and things will just kind of go from there. And everything is connected in our brain, so it still works amazingly. With the crocodile technique, we keep it focused. So what we're doing is when somebody is performing an addictive behavior, right, there is a disconnect between the consequences. So they know what the consequences are, but the addictive behavior is immediately reinforcing whatever they need, right? So with the crocodile technique, we're focused on the sensations for the urges and the sensations for the consequences. It actually makes a literal connection in their brain. So what happens is over time, ideally the addictive behavior just becomes uninteresting. So obviously they're still going to need to process, right, whatever events or work on whatever events led up to the addictive behavior, and also continue to utilize the skills that they're learning in treatment, right, or other places. But they are definitely put in a position of strength. So it makes recovery just it's a whole different ballgame for recovery. And it makes things a lot, I want to say a lot easier, because they have that literal change in their brain and that foundation. It's a huge strength. Okay. Next slide, please. So once we do that, right, work with them on connecting those sensations, we always want to focus on expanding, right, or having them explore what their future looks like without that addiction. So again, ideally, in my practice, right, I will utilize Brainspotting and I will utilize the crocodile technique. With my contract at Seven Arrows, they do have a primary therapist, right, on site. So they will work with them. And then with me, the only thing that we do is the crocodile technique. But I would not just do the crocodile technique and send somebody on their way, if that makes sense. Those other pieces are very important, right? So along with the conversations, right, and making sure that we can kind of wrap them up with care depending on where they are and things like that. You can actually have them brain spot what their future will look like, right, without the addictive behavior. So I do have a lot of clients, when they utilize the crocodile technique, they will say they feel like, actually, this is interesting, that it's easier to do just regular brain spotting. So a lot of times if you have a client that comes in and they are open to focusing on whatever experience led them to start performing the addictive behavior, depending on the individual, right, and what's transpired, sometimes the addictive behavior will fall into place on its own, if that makes sense. Because if they address the trauma piece, again, this piece just becomes unimportant anymore because they've set their central nervous system and rewired their brain, made themselves a whole lot lighter, right, by dumping all that old stuff. And they figure out that they don't need to utilize this as a coping mechanism anymore. So again, we're still utilizing all of the other tools that we've learned because this is a process. But that is huge. And gives people a lot of hope. It's very empowering. And I think too, from a clinical perspective, right? I worked in community mental health for a long time. And with these newer techniques, I love coming to work. I love seeing clients literally make changes the first time they do brain spotting, healthy changes. It's just a really amazing thing to see. And it really, as far as therapy goes, it's motivating for the client, right, to want to continue to work on whatever that is to move them towards having a healthier life and enjoying life and different things like that. So, next slide. Okay. So I know Debbie's going to send out the PowerPoint, but I added some resources. So just the website for brainspotting.com, that does have all of the information regarding the trainings and things like that. They purposely do not put a lot of information out about brain spotting. They do not want people brain spotting themselves, right? So it is kind of limiting, but yeah, that will provide all the information for trainings. Brain spotting, David Grand's book, amazing book. Even if you're not interested in doing the training, it will provide you with a lot of information and insight just into this particular technique. Brain spotting with children and adolescents, an attuned treatment approach for effective brain body healing, and then also brain spotting with young people. Brain spotting with young people is my favorite book to utilize to work with kids. They use a panda to explain the process. It is a very difficult process to explain to a client, especially if, you know, it's their first time meeting with you and they have some anxiety and things like that. There's a lot of words and components that can seem a little bit scary when you're talking about different levels of consciousness and things like that. I do not use that word with my clients. Just say, instead of thinking, we are feeling. And feeling is scary too, right? So definitely want to have a conversation about that. We generally spend our whole lives not feeling, right? And society kind of cultivates that as well. And so now we're asking them to be 100% vulnerable with us and just focus on all of those feelings. The amazing part of it, though, is when they do that, they will notice a significant change in how they feel immediately. And once they do it, right, they don't need to do it again because it's gone. So it's like they will have a memory. They will highly unlikely be triggered because there's a disconnect now because there's no negative emotion that's attached to that memory. If they do happen to remember it, it's almost like looking at a wall, because there's literally no emotional connection to it at all. And that just feels amazing. So, and the last slide, I believe, is just information about me. So I would be more than happy to take questions.
Do you want me to go through kind of the chat and questions or Q&A? Do you want to look through there? It looked like there were questions. Let's see here. See if I can find the beginning of the questions.
I have
Oh, go ahead.
Oh, I was going to say, I can do the few in the chat.
Oh, perfect.
Okay, so how is brain spotting different or similar from EMDR or hypnotherapy? So there is literally we're not hypnotizing anybody. When we're looking at levels of consciousness, right, the individual is 100% alert and control of their session. Okay, so when, like, as I mentioned before, and I'm sure maybe this has already been answered, but we are just feeling instead of thinking. That's it. That's the only difference. So with we are not utilizing any tapping or eye movements. We pick one focal point, right? That brain spot is one particular point, and we have them hold that spot. So let's see. Brain spotting with children. So again, the youngest, we can use brain spotting with infants.
I'm curious, why would you need to do it for an infant?
So if if an infant has been, if there's attachment issues, um, if there's some substance issues, things like that, I
Oh,
think, yeah.
interesting. I was just,
Yep.
I saw that and I was like, what would a baby? But that makes sense. Okay. Or
Yeah.
abuse or something, I'm sure.
Yeah. Um, So it says, I'm curious to know if the guy who created brain spotting took techniques from EMDR. So he actually was doing EMDR with a particular client so he was having her do the eye movements when he noticed in a particular spot, her eyes like jumped. So they started kind of flickering. So he decided to have her hold that spot. And then there was an activation. And that's actually in his book, and it goes into detail of how he came across that. So that outside of that particular, technique that he was utilizing to discover it, there's no other techniques like from EMDR that are utilized in brain spotting. So brain spotting can be used in conjunction with EMDR. All of the tools that we have can be utilized together, right? I mean, yeah, I use everything with my clients. I just, I'll ask them to be open to the process. And sometimes they have a favorite and we'll stick with the favorite. I'm going to utilize whatever my client, feels comfortable and safe with. Um, but also you can utilize them with everything. It can be done telehealth or in person. So there are brain spotters all over the world and in remote areas. And so they have always done this via telehealth, which is phenomenal. Obviously, as a clinician, right, you're going to get to know your client. You're going to figure out whether or not they are appropriate to be doing something like this via telehealth. If I have a client who is highly dissociative, and this is just me personally, or maybe, their home isn't the safest place, I am going to recommend that they come in person so that I can hold space for them and that they are in a safe place. But yep, it's done via telehealth all the time. I do telehealth and in person, so it can be done. And I do all of my brain spotting at 7 Arrows is via telehealth, and it works fabulously.
Let's see. So some from the chat, people who have had eye surgeries, low vision, legal blindness, would they be appropriate for this treatment?
Yes, I actually asked the same question in my training.
Nice.
Yes.
Let's see. Would laughing also be considered a behavior or sign?
Yes. So a lot of people will laugh, right, when they have high anxiety or they're feeling uncomfortable. It can also be utilized as an avoidant, right, mechanism. So absolutely.
Let's see. Is the training required to do brain spotting as intensive as EMDR training?
I am trained in accelerated resolution therapy, which I call it sort of like a sped up EMDR. I am not trained in EMDR, so I don't know what that process, the training process is in detail. However, for brain spotting, it is a 3-day training. And you are, doing brain spotting with another clinician, and the clinician is also doing brain spotting with you as well. So they are very big on having those individuals that are, getting trained in brain spotting work on their own stuff as well. That is what the phase 3, the deep dive training, is for clinicians. In order to, everyone has stuff, right, to work on their stuff. So, but yeah, it's a 3-day intensive training. It's kind of it. We're just doing brain spotting back and forth.
Let's see. What client would not be an ideal candidate for brain spotting? So I guess, is there a limit, or should you not do it with some clients?
Technically everyone would be appropriate for brain spotting. But again, you're going to meet with your client, right? You're going to know your client. You're going to figure out what's appropriate for them or not. There are so many different techniques that really, yeah, I mean, it's appropriate for everyone. I know a new training just came out, I think it was a few months ago, that is specific for individuals working with the SMI population,
Nice.
which I can imagine would be a phenomenal training. So
How does it work with clients who are on the spectrum? Is that kind of the same question?
kind of, yeah. It's again, it works great for clients on the spectrum, right? Obviously, you're going to work within, their parameters. But again, you can do brain spotting with somebody for 10 minutes and it's still valuable. Even if somebody's not able to identify their feelings, right? And that does happen too. There are ways to kind of explore with them a point to start. And eventually they will be able to verbalize, I think I had a feeling, or I felt this here. And a lot of times when we take the words out of it, right? So we're not saying like, where do you feel anxious? Where do you feel angry? Where do you feel, I'm saying taking any words out of it, what's going on in your body right now? Because at the bare minimum, they might feel a little bit nervous, right? Or anxious because they're going to start brain spotting. So that's where you can start with them and say, okay, what's going on in your body right now? Maybe my stomach's a little bit upset, or I have a little bit of pressure in my chest, or I notice some tension in my jaw. Then you just have them focus on that. So other clients may be able to, brain spot for an entire 50 minutes or an hour, which is fantastic. Not everybody has to do that. Each process is an individual process, and we just respect that process. So I always tell my clients, right, there are a couple things to be curious about, because they will continue to process when they leave, which means their emotions are going to kind of be up and down. So I'm like, goal is, small roller coaster, not big roller coaster.
I like that. More questions about blindness. Did you answer the blind question? And let's see. Somebody says, I'm legally blind and I've had 17 surgeries. I work with people on the spectrum of vision loss. I'm wondering what limits there are. For example, I have a hard time focusing on a spot and my eyes can physically hurt.
Okay, so what we would have you do is just focus on the sensations in your body.
So not the whole eye.
Correct.
Okay.
And just, kind of gaze side to side maybe, or up and down, kind of notice where the sensations may get a little bit more intense. A lot of times with my clients, if once they find their spot, if they feel comfortable, I'll have them close their eyes. So as long as their gaze is in the direction, right, where those sensations are a little bit more intense, they don't need sight. They just need to feel.
Let's see. Does the crocodile technique work for porn addiction?
Yes.
What would be considered stabilization?
So somebody that is not suicidal or in, crisis.
Okay.
I would,
Go ahead, sorry.
I would take into consideration also if somebody, well, I mean, if somebody was actively experiencing psychosis, right, I would definitely explore that a little bit further with them.
Okay, I wonder how this would work with sugar cravings. I tell you, sugar cravings make me want to go inpatient seriously. I could fall under that one.
It actually works fabulous for that.
Oh, hey, maybe I need to schedule an appointment. Love my chocolate. Let's see, how would it work with people, persons who've experienced human trafficking?
Okay. Well, so it kind of depends on where the client wants to focus. I can definitely see multiple different routes to that, right? So again, somebody with complex trauma, you want to go a little bit more slowly. We never want to open up Pandora's box, right? That's not ideal in any regard. So, like I said, what's really good about brain spotting is our brains do have that safety mechanism. So if we're not ready, our brains will shut it down. And that's not a bad thing. Like that's okay, right? That kind of tells us, where we're at and where we need to go moving forward. And we just need to go a little bit more slowly. And
That makes sense. Let's see. How does it work with clients who engage in substance use binging? So during more distressed times, but then also have periods of abstinence.
so again, you could use brain spotting or you could utilize the crocodile technique, right? So you could focus on, um, what is the deeper issue, right? That's created the binge eating. Or you could just connect the sensations in their body, like the urge, right, to binge eat with
Or binge substance use.
binge substance use.
I don't
Okay.
know if it's the same as eating or
Okay.
the
Yeah. So
thing
the
you're doing,
urge
I
to
guess.
want to use, period, right? Just the urge to want to use, where you would focus on the sensations for that urge and then focus on the sensations for the consequences. So that can be a literal consequence, right? Or it can be how they feel afterward, right? Whether it's, embarrassed or ashamed. I've had clients before say, their consequences, I feel great. I feel great after I use, right? So that's where we focus. If that's what's going on with them, then that's where we focus. So we always want to meet them where they're at and work with them within those parameters.
Makes sense. Is it useful for grief and loss symptoms?
Yes, it actually is wonderful for that.
Let's see. Are there prerequisite trainings before the phases, and is it an evidence-based practice?
It is an evidence-based practice and there are no prerequisites. There actually was, I had a master's level student in my training and his mom attended, who was a lovely lady, but she was not a clinician. And yeah, I actually worked with her. It was phenomenal. And honestly, I felt it was kind of helpful for me not to have to be working with another clinician, if that makes sense. I mean, we rotated, but it was just a very different experience. And she was amazing at holding space and she didn't overthink all of the things, we ask all the same questions that you guys are asking me. So
That's cool.
yeah,
Can you work with nonverbal clients?
that's a good question. I feel like you can. Um, I mean, there are so many creative ways to communicate with people, right? We can use colors as emotions. You can utilize, pictures, have a picture of a body and have them identify where they're feeling different things. We don't necessarily need the words, right? The words we're taking out of it. So yeah, I feel like we would still be able to do that.
Let's see. I know once I worked my steps, I have no more emotions tied to my bad memories. It's a blessing to be free from those overwhelming feelings. I like that. Can you give an example on how to do the crocodile technique?
Absolutely. So with the regular brain spotting, right, we have the one brain spot. With the crocodile technique, we have two. So what we do is we find the first spot, which is the urges connected to the consequences. So the same thing as I would do with regular brain spotting is I would have them scan their body from head to toe, right? Think about a particular situation or maybe a pattern of behavior, right? So I had a client say, oh, it's definitely when I'm walking down this hallway, a particular hallway, I know I'm going to go use. And so that's what he focused on. Um, so just scan the body from head to toe, notice what sensations come up, and then you have them follow the pointer, or, you know, if you're doing the gaze spotting, that's different, but you have them just follow that with their eyes. And there are different techniques to access that area of the brain, but just the easy thing right now is just to have them follow it with their eyes. You're watching for those involuntary responses. You're asking them for feedback too, right? Where do you notice those sensations get more intense? Where maybe do they move to a different place in your body? Have them note that area. So once you find that area, that's the first spot. You do the same thing for the second spot, but this time they're focused on the sensations connected to the consequences. So once you find those two spots, this is where the client is going to look back and forth between the two spots. And while they're doing that, they're focused on the sensations in their body. Okay. So they're looking back and forth. They do it at their leisure. Okay, there's literally no wrong way to do brain spotting at all. So someone may stay on one point longer than another. Someone might go back and forth rapidly. It's completely up to them. And they just keep doing that until the session is done, or they decide, right, okay, I'm good. A lot of times with the addictive behaviors, it gets really, really intense. They tend to get headaches, but the headaches pass. So anything that comes up will pass. So that's definitely something that we want to communicate, because they're processing, deleting, right? It's going, it's going. So I sort of, as a visual, I don't know, kind of like outing my age here, but when we used to log on for AOL, right? And you had the startup with the internet, that's kind of where
Yep.
between the urges and the consequences, you're literally making a connection in the brain. You're making a literal connection. It's just like like connecting. That's what you want to do. So what that does is eventually, right? It creates a pause internally for you to be able to say, okay, hold on. This is what I used to do when I felt this way, but that's not a good idea. So I'm not going to do it. And ideally, if you're working on your, trauma or whatever else that led up to the addictive behavior, you most likely won't have a trigger anymore.
Huh. The AOL makes sense to me. So
Okay.
yeah. I always like, yeah, things that I have to kind of put them together in my brain. Let's see. What is your take on ART therapy?
Accelerated resolution therapy, is that
Yeah, I'm guessing.
okay? So I love art as well. Kind of in my practice, what I've seen is I like to utilize art when it's for a specific situation. So for example, if I get a lot of teenagers that are like have to take their driving test, right? And so we'll do art for that. I'll do public speaking. I've done, attorneys who are young and new and they maybe have to go to court. And they have some anxiety about that, or somebody that has to fly and they're anxious about flying. So very specific events because you can put parameters around it. Again, like art is controlled by the clinician because you have a script. For trauma, especially complex trauma, I personally prefer brain spotting. But again, but my clients know that I'm trained in both, so they'll try both and then sometimes they'll have a preference. And sometimes they don't. Sometimes we'll utilize both of them intermittently. Just kind of depends on the person. So
Let's see. It sounds like brain spotting is best used as an adjunct therapy. Is that correct?
I feel like all of them are best utilized as adjunct therapies, but honestly, not necessarily. I feel like if somebody wanted to come in and do brain spotting and maybe they've had therapy in the past, you could solely brain spot with them. Like I said, the recommendation is 1 to 5 sessions. Yeah, and kind of discharge them successfully.
How are the results tracked or realized?
So that would be through yeah, brain spotting with Dr. Grand. So a lot of his clients actually during right after 9/11 were therapists. And so they were, taking the techniques that he was utilizing with them and utilizing them with their clients. And there has been a lot of research. Like I said, it is evidence-based. So that is something that goes through his program.
Let's see. Are there instances when brain spotting isn't effective or a client doesn't respond favorably? If so, how do you approach that?
I'm sure there are
Does it never
instances.
not work?
No, I asked that question actually when I was in training. It always works a little bit at least. I think, if somebody's not motivated or they're not interested, it's not going to work, right? Just like any therapy. I mean, you can come to therapy, but if you're really not actively participating, it's not going to work, right? It's a two-way street. Personally, I would say teenagers have a little bit more difficulty being open to brain spotting, but for various reasons, right? So like I said, I'm very careful about using words like consciousness, right? Different things like that. Less is more when I kind of describe the process. And once they go through it and they see, oh, I am totally in control. I got it. I did have a client that got a little bit anxious because he didn't understand the process. So for him, he was uncomfortable with that. I can respect that. He thought I was magical, quote unquote. And I'm like, and as a clinician, we're not doing anything. We are holding space for them, right? We are, again, that tail of the comet, and they are doing literally all of the work. But, sometimes that's hard to kind of understand because it really is difficult to describe. So I've been doing this for the last 3.5 years, and every single client that I've worked with has a different story to share about their brain spotting experience. And even from session to session, the experience can be different. So again, it's really just being open to the process. And I always tell my client, anything that comes up, just be curious. Just be curious about that, right? Because something can come up, maybe a memory that why would they, from kindergarten, like 8 months later, where it just kind of runs across their mind. And they're like, oh, never thought of that. But maybe it makes a connection or provides them some kind of insight into why, something led into this. But since the emotion isn't attached to it, right, it doesn't have any kind of negative impact, if that makes sense. It's just really an opportunity for clarity. So yeah, I would say especially the adolescents with a history of like trauma already, the ones that have substance issues, they are a little bit more hesitant because they're not necessarily ready to work on their trauma. And when you go there in the brain, because everything's connected, you really don't know what's going to come up. And so that can be a little bit scary.
Let's see here. What licensure is necessary and what's the usual session time?
So a typical session would just be your regular session. So, 50 minutes or an hour, whatever the individual is doing. And I don't believe a specific license is required.
Okay. Uh-oh. somebody says, talk about art.
Art.
And then how would you compare it? Which I think you already compared it.
I did. Yep. Well, so briefly again, Brainspotting is a client-led therapy. No, there's literally no way that it can be done wrong. There's always value to it. With art, right? That is a therapist-led therapy because you have a particular script. And the scripts are great because they guide you. You can just, utilize one in general. There's one for a typical day. So maybe you have, just for, an example, a single parent who has kiddos and they have a job and, activities and multiple things going on. And externally, they can't necessarily change anything, but they feel very overwhelmed. Utilizing art and walking them through a typical day can help regulate, right, down regulate their central nervous system so they can actually be present from moment to moment without feeling so overwhelmed. So you're actually making those changes internally, right? You can utilize art for a future event. If somebody needs to be prepared for somebody, or if they are having difficulty making a very big decision, you can actually do some exploration through art, and it will provide you with some guidance and clarity, kind of which direction to go. I have utilized art for individuals who had people pass away and maybe didn't get to say goodbye, and they have been able to go back and say goodbye, which has just completely changed their lives. You can also do that with Brainspotting. So, it just really, like I said, I really like to utilize both of them. It just kind of depends on the particular client, right? And knowing kind of, some background or, having a conversation with them, like, what do you feel like? What are you open to? So.
Interesting. Let's see. If you start brain spotting with the client right after meeting them or immediately following an assessment, how do you establish a connection and building a therapeutic relationship with the client?
So me personally, I always do a phone consultation, a free phone consultation before meeting somebody if they are open to that. I will do it though if they are coming to me just for brain spotting. I always do an intake session. I never just have somebody come in and sit down and brain spot. Because a lot of times too, right, clients don't always share all of the pertinent information, right, up front. And I am a very visual person, so I need to see somebody's face, right? And then when I'm answering questions, and also I want them to put, a face to the name for me as well. Because obviously, not everybody that comes, not everybody that we meet, right, is going to like us, whether we are skilled in a particular technique or not. And we want to make sure, right, that our client is set up for success. So, for me, if I'm meeting with somebody and I don't feel like it's a good fit, or I can tell they don't feel like it's a good fit, I'm more than happy to provide them with recommendations for another clinician because I want them to have that opportunity to be healthy and successful. So, or maybe if I, know somebody that specializes in something that maybe is not my jam, I'm going to give them that information. So, but I will always do an intake session first, and we always have a conversation about, what brain spotting looks like and things. I mean, that's part of their treatment plan, right? So, yeah. And if I feel like they need follow-up, then I will make that recommendation too.
Says, please repeat the success rate of either concepts.
For brain spotting and the crocodile technique?
Oh yeah, I guess. Yeah.
Well, so I feel like
always
success,
successful, right? Or it's perspective of like the person.
correct. I feel like that's subjective. I feel like it's always
Subjective.
successful. Yeah, it's always successful in the fact that somebody, even if they do it once, like I said, and it's for 10 minutes, right? They have developed a foundation to build on if they want to sometime in the future, right? So in that regard, because it's a literal, like physical change in your body and your brain, and you don't ever lose it. So I feel like that's positive. But again, success is up for interpretation, right? And based on client perspective. So I can tell you, with the clients that I've worked with in the past, 3.5 years, and even the ones at the recovery center where I work, all of them have been successful, right? In whatever that looks like for them personally.
Person. Let's see, would it work with those who are in high stress environments such as incarcerated patients?
Yes, it's actually an amazing tool for them because they don't have to talk about things, right? And it's also helpful for the clinician because sometimes when you're working with those particular populations, right, some very difficult, past experiences and things like that, we don't necessarily have to carry that load either. So as long as, again, somebody follows up, right, with somebody, I feel like that's important. And I know that's not always an option when you're working with individuals that are incarcerated. But then again, you get creative with the particular technique and you make it work for them to be able to set them up for success, whatever that looks like.
How much time should there be between phase 1 and phase 2 training?
No timing. That's completely individualized. You could do them back to back if you want. I will tell you the training for a clinician also is extremely draining. So even when you're working with clients, because there is an energy exchange, right? There is a lot going on. You learn very quickly how to create an emotional boundary. Otherwise, you will absorb all of that energy. I remember when I first started doing it, doing 6 brain spotting sessions in one day. I could barely drive home actually.
Oh.
But I've learned we kind of talked about, we all have little mantras that we'll say in our head that helps to not really get pulled in to the energy, because a lot of times the sessions can be really intense. I've had clients vomiting before. I had a client, get up to try to run out the door, and I just very quietly said, "You're safe." And they sat back down. I've had clients screaming before, right? So they can get pretty intense, and all of that is normal. There's nothing abnormal with the individual's process, but they're processing. And so, we're holding space for them, lots and lots of energy. So those trainings can be very intense, but there's really no specific time frame between, whether or not you want to spread them out or you have to.
Awesome. Sorry, I'm just taking there. Oh goodness, now I lost my spot. I shouldn't have done that. Did you say this can cause headaches in clients? If so, are there medical considerations to take into account? Would you consult with a medical doctor beforehand? And is there concern in using a technique that causes a headache or joint pain?
Okay. Well, so I would say, we always want to ask our clients if they have any medical issues, right? And we want to take those into consideration. So it's very possible, depending on your client, that we may need to coordinate care. And that's always ideal, but we also know it's very difficult to make that happen sometimes. So definitely, could possibly warrant conversations. I wouldn't necessarily say that brain spotting causes a headache. That is an individual, right, issue. So, and it's probably verbally conveyed as a headache, but what's going on is they're processing, right, through the sensations that are connected to different things. And so the pressure is coming up, but it always passes. So it's not something that is like so disabling that it creates any kind of medical issue or things like that. So I would say I don't know if you want to call them side effects, but I always tell my clients, you know, after brain spotting, you are going to be tired. Okay. You will probably be a little bit more thirsty and you might be a little bit more hungry. And so that self-care piece is really important that day.
That makes
But
sense.
because their body, yeah, will continue, their body and their brain will continue to process. So it's going to be a little bit bumpy. It takes a few days to kind of settle. That's normal. It doesn't keep anybody from doing anything though. Does that make sense? That first day you'll be a little bit more tired. But it's not something that's going to have such an impact that you're not going to be able to like function. If that's the case, right, that's okay too. We just want to make sure, you know, like I check in with your client, you know, things like that. Yeah, so did I answer that question all the way?
Yeah.
Okay.
Let's see. Can it be, so this will be the last question. And then Erin's information, do you mind if somebody had another question that we didn't get answered if they emailed you or
Not at all.
Okay,
Absolutely. Email me. That would be great.
perfect. So can it be utilized in group therapy for patients who are experienced in brain spotting, or is it far too individualized?
It far too individualized. It
Okay,
wouldn't be appropriate in a group setting.
awesome. So
You want to, that dual attunement piece is key. So you want to make sure, right, that you are highly attuned to your individual client. And if in a group setting, right, your energies would be pulled in multiple places. So that wouldn't, you know, be appropriate.
oh, and one last question, sorry. You
That's okay.
mentioned brain spotting can be used with parts therapy. Would you have an individual move to a positive spot when they activate a negative spot?
No, you actually want, I know it sounds weird, but you want to encourage them to remain in the negative, wherever the negative sensations are, because those are the sensations that you want to delete, right? So those files with the negative emotions are the ones that you want to delete. Again, if it's too like difficult for them, right? That's where you would talk to them or have them find a calm spot in their body or a grounding place, or you can have them cover one eye, believe it or not, that decreases the intensity of it. Or they can stop, right? And then you can have a conversation. Okay, how can we set you up, right? Or to put you in a position where you're able to process through the difficult, you know, sensations, and be grounded. So maybe looking, you know, for a picture or that guided visualization, like things like that. So yeah,
Fascinating.
it sounds weird, but you kind of want to get them to process through the icky stuff.
I like that. Well, thank you so much, Erin. This has absolutely been amazing. Anyone who had the question about CEUs, I will send them out this afternoon with the PDF of the presentation. And again, if you did have a question that I didn't see or didn't get answered, feel free to email Erin. I put that slide back up so you have the information. We always appreciate everyone attending these. And we doubly appreciate our presenters, absolutely amazing. So if you are interested in brain spotting for yourself, because I know sometimes the clinicians don't probably, get the help sometimes. So please reach out to Erin. She's here in Scottsdale. And it has been just an awesome day. Thank you so much, Erin.
Oh, thank you so much. I appreciate it.
I hope everybody has a great day, and we will see you next month for our next CEU. Thanks, Erin.
Thank you. Bye.
Bye.